We have like 2.3 million cases of breast cancer every year.
You get diagnosed with breast cancer, you're dead. No.
Breast cancer, if we catch it early, the survival rate is up to 98%. That is a lot.
All medicine nowadays is going towards the minimal invasive.
Every patient I treat, they leave a mark on me.
How often do you recommend psychological support for the patients?
Patient that after 2 months from a bilateral mastectomy, she ran a marathon.
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
October is the month of breast cancer awareness. It is very important that all the women and men will start an early diagnostic process in order to detect and treat a sign of a cancer at a very early stage. I'm Dr. Matteo Vigo, I'm a plastic surgeon, and welcome again to another episode to Beauty Talks by Dr. Matteo Vigo. Today I decided to invite a friend, an esteemed colleague, and someone who is really into the field of breast cancer, because a breast surgeon that works for many years in the UAE and before in Italy, treating women for this very important topic that has a full month dedicated to, because we really need to sensibilize women around this big project. Welcome, Dr. Annalisa.
Oh, thank you, Matteo. I'm very glad to be here.
So give us a little bit intro about you. What is your background? How long have you been in Dubai?
Yeah, so as you said, I'm a breast cancer surgeon and a breast specialist. So I think I am the right person you need to go when you have any kind of breast issues, and also for your annual routine checkup. So I completed my medical studies and also my postgraduate diploma in Italy in general surgery. And then I've worked also at the National Cancer Institute in Milan. And then after a few years, I moved to Dubai in 2016. And since then, I've been working at Well Woman Clinic.
Yeah, I remember, your husband calling me from Italy, said, we're moving to Dubai, what shall we do? So I was one of the first person you met when you came to Dubai, right?
Yeah, no way.
I was there already for a few years.
And you've been so nice and kind to, in welcoming us.
No, I really, also the husband is a good, very good doctor. We work together a lot, so we refer each other a lot of patients because we trust each other in our work. So let's dive into the topic.
Yeah.
So how important is the early diagnostic in breast cancer?
So, Matteo, and so despite the progress of breast cancer research and treatment, breast awareness is still something that is very crucial, So because early detection is the most powerful tool we have to save lives. But unfortunately, many ladies, I would say, they underestimate the risk of getting breast cancer, and maybe they delay or they cancel their routine appointment for screening out of fear, lack of time, or misconception. But today we know that breast cancer, if we catch it early, the survival rate is up to 98%. That is a lot, So I will never stop underlying the importance of being checked, of going to the doctor despite having any symptoms.
Yeah, because we should remember that breast cancer is the highest number of deaths in the woman category for cancer, right?
Yeah, exactly.
It's the most incident of cancer in a woman population, and you have the tools to prevent this.
Exactly. So why not?
Exactly. So what are the early symptoms that? Okay, we do the yearly routine, as you said. You come and you do your ultrasound or mammogram, whatever is needed. But what are the signs and symptoms that women or men, as I said, because breast cancer also happens to men, very rarely, but it can happen. What are the early signs that a woman should look at?
Okay, so fortunately, we detect cancer in most of the cases through screening protocols, so when there aren't any symptoms. But anyway, if there is a sign or a symptom of cancer, it's not too late. So the most important one is when a patient feels lumps. The lumps can be also benign. They can be like a fibroadenoma or a phylloides tumor or a simple cyst, which is like a balloon with liquid inside, and the quantity of liquid follow the hormonal changes, So, but the lump can be also cancer. So whenever you feel a lump in your breast, you need to go to the doctor and be checked. And then another symptom can be the nipple discharge. So also the nipple discharge causes can be absolutely benign, like hormonal imbalancement or inflammation or infection.
Mastitis,
or exactly, or the presence of a tiny nodule, which is called papilloma inside the duct, and can be the reason of a discharge. So in most of the cases it's benign, but rarely can be also linked to breast cancer. So every nipple discharge, especially if it is monolateral, has to be reported to the doctor. And then what I usually say is just be aware of any changes in your skin texture, on the skin texture of the breast, and if there is any like nipple retraction or skin retraction, or if there are any new skin lesion, nipple lesions that are abnormal for you, you need to, it's always better to go and be checked. And as you said, also men can have breast cancer. Actually, it's a very rare condition because only 1% of the total number of breast cancer is for men. But yes, anybody can be affected by breast cancer.
And I think one of the most powerful messages is also to start with autopalpation at home.
Exactly.
When you're under the shower, just every time you shower yourself, just palpate your breast and you immediately feel there is something wrong, right?
Exactly. You start learn how your breasts are made month by month, so you can notice if there is any difference. You can recognize an early sign of cancer.
Exactly. And what is, in terms of screening, so the doctor appointment and the ultrasound or mammogram, what is the gold standard for the age to start this treatment?
Yeah, so the gold standard is still the mammography. And the mammography, especially nowadays, we have a 3D mammography that is called tomosynthesis. And the tomosynthesis gives us a much better information about all the layers of the breast tissue and can detect very small breast cancer. But we can start with the mammogram at the age of 40 because before our breast is more dense, and so we cannot detect any tiny abnormalities that we want to find. So before the age of 40 is still very recommended to get an annual ultrasound. And I would say we can start like at 25 because I currently see patients with breast cancer like at 26, 27, 28.
Wow,
yeah.
so very early.
So as soon as we start, I always recommend, let's start at 25, get this habit of going to be checked once a year, having your ultrasound done, and you are in this way, you are on the safe side. So if something bad arises in your breast tissue, we can catch it early. And
you have a history, so also all the pictures, the ultrasound has been saved. So
exactly.
If you go on the same, now also in Dubai we have this Nabid, which is a very powerful tool because all the clinical data of a patient are connected. So if you jump from one center to the other, still we can see what happened before and we can track your progress.
Exactly. So the recommendation start with ultrasound from 25 to 40 once a year, and from 40 mammogram and ultrasound together because they can see different things. Mammogram is more to detect breast distortion and microcalcification, and especially at the beginning of a cancer, we have a cluster of microcalcification, so just a tiny dot in your breast. And the ultrasound can see if there are any nodules, if these nodules are liquid or solid. It can check better your axillary lymph nodes. So we put together the information to have a complete assessment of your breast, So, and many patients ask me, what about the MRI?
Was my next question. Okay. You just take it before me, yes.
So the MRI is always not the first step investigation, is a second step investigation. If something is abnormal or uncertain at the mammogram and ultrasound, we ask for an MRI. Or if, for example, there's an issue with the implant, the MRI is very precise in telling us if the implant is, there's a rupture of the implant or not. Exactly, so you know better than me. And or in cases of breast cancer where we need to have a more precise idea of the extension of the breast cancer. So we use the MRI in these cases. Or we use the MRI as a first step investigation only in high-risk patient. So it's included in the high-risk screening protocol, where for a patient with very strong family history or other risk factors or a mutation of the genes, they will have alternating every 6 months mammogram and ultrasound together, and then MRI. So every 6 months they are checked.
Interesting, very interesting. And because, of course, you work back in Italy before and now in UAE, what is the incidence globally of breast cancer compared to the UAE? Is higher here, is less than the globally?
Yeah, I will tell you some data. So globally, unfortunately, the breast cancer is, as you said before, the most common cancer in women. So we have like 2.3 million cases of breast cancer every year. And so it means that every 4 seconds, there's a diagnosis of breast cancer. So it's a very common disease. 1 in 8 ladies during her lifetime will experience breast cancer. So fortunately, here in UAE, the numbers are a little bit lower. So we have like more or less 1,000 new cases every year, so it means 4 new diagnoses every day. But what is concerning is the age of the patients. So we see many more younger patients compared to Europe and US. So we see patients in their 30s, in their 20s.
But can this be done, just came out of my mind now, because the population of UAE is younger compared to the rest of
Can be absolutely one reason, but also, genetics plays an important role, and also lifestyle and environmental condition can influence the breast cancer risk.
Yeah, and you have among your patients both local ladies and expat, because you have a huge expat community. You are one of the few Italian doctors dealing with breast cancer, so and you're here since a long time, so a lot of women are coming to you from the Italian community. What is the percentage of locals versus expat, and how is the attention here, and especially in the UAE, to the screening? They're attentive to that, or they're a bit reluctant?
Yeah, so after 10 years in Dubai, I can surely say that there are some ladies are still very hesitant to go for a screening check, maybe related to the cultural stigma or the fear of the results, or the fear because they think that mammogram is very dangerous for their health, or just because they have the opinion that if I feel fine, I must be fine. But it's not true, because we know that breast cancer can be absolutely asymptomatic, especially at the beginning, months, So, but I see that on the positive aspect, I see that nowadays there are much more screening offers, screening events, breast cancer awareness is growing, and we are invited to talk to the young students at schools. So the awareness is growing, and I see recently many more women coming to the clinic seeking for an annual normal routine checkup.
Without any symptoms.
Exactly, without any symptoms.
Which is the most important at the end. Again, as you said, you don't have to wait until you have the symptoms to, something is wrong. If you feel fine, doesn't mean that everything is always fine.
And
Most of the time, yes, thanks God. But sometimes you need to really, look into
and
that.
especially younger people are more, maybe more informed through social media, so they come and ask for a check.
And then you said that here the incidence is a little bit less than worldwide. But do you think in general breast cancer has more prevalence of genetic influence or lifestyle influence? What are the two things?
We know for sure that like only 5 to 10% of breast cancer are purely genetic.
The BRCA genes, right?
Exactly. So they are linked to a mutation in some genes. The most famous are BRCA1 and BRCA2, but there are also other genes that can increase your risk of getting breast cancer up to 80%. That is a very high risk. So always when a patient comes in to my clinic and when I ask for the family history and she has a strong family history, I always recommend to get a genetic test to rule out any, genetic predisposition, because nowadays if a patient has a genetic mutation, the recommendation is to get a bilateral mastectomy.
And we know became famous with Angelina Jolie that did for herself because she had a mutation.
Exactly, to avoid that this patient is going to face a breast cancer episode in her lifetime.
Especially also, I just came back from this event in Croatia where we're talking about the breast tissue preservation, and they're doing now this breast mastectomy in a very preserving technique. So it's, of course, a preventative mastectomy. And the results with immediate reconstruction are stunning.
Yeah, very natural.
Very natural. You barely see that you have something done. And again, this is the future also on the surgical part. Because from my side, of course, the reconstruction has a lot of step forward compared to the past years. But what are the news in the surgical approach to the breast cancer from your side?
So the surgical technique changed a lot in the last 2 decades, I think. So we are going forward a less invasive and more personalized approach. And for example, the oncoplastic surgery allows us to just remove the cancer and a little bit of normal tissue around. So we can we can preserve the shape of the breast, and we can achieve a supernatural and very nice results. And also maybe sometimes the scar they become invisible month by month because they are sometimes also hidden in the inframammary fold or close to the axilla or just in the perioral area. So and also for the surgery of the axilla, performing the sentinel node biopsy. Nowadays, the sentinel node biopsy has replaced almost in every case. I cannot say in every case, but in most of the cases, the axillary dissection. So we can just test a few nodes, 1 or 2 nodes of the underarm instead of removing all the lymph nodes. And so in this way, we can avoid the patient to get a complication like chronic pain or swelling.
Yes.
Exactly, lymphedema or just, nerve lesions.
Damage, yeah.
Exactly. So we can improve the quality of life of the patient.
Again, I think all medicine nowadays is going towards the minimal invasive. They do now all the heart surgery from the intravascular approach. We do now the breast augmentation to the minimal invasive technique from the armpit. So everything
that's
goes.
amazing.
And I've seen also a few years ago already the robotic mastectomy that they do from the side of the breast, and like just a robot goes in and precisely remove all the breast tissue, put an implant, and the surgery is done.
The future will reserve us many surprises.
Exactly. But how do you decide when to go for just a simple lumpectomy or nodulectomy or to go for a mastectomy?
Yeah, so the choice depends on many factors. So, for example, the size of the tumor, it's very important. But the size compared to the size of the breast, because, for example, a nodule of 2 centimeters can be huge in a tiny breast, in terms of preserving a natural shape after the removing of the lump, or can be the same nodule, can be tiny in a huge breast, and the breast conserving surgeries can be done absolutely easily, you know. So the size, the location of the cancer, the preferences of the patient, the genetic predisposition. So whenever it's possible, I advocate for breast conserving surgery because reconserving surgery plus radiotherapy offers us a very good outcome. Also in terms of survival rate and the cosmetic results.
And when is the mastectomy mandatory?
When it's mandatory, when, for example, the cancer is an extensive cancer or it is multicentric, so it has the involvement of many areas of the breast, or if there is a genetic mutation. So just to not to focus on treating that cancer, but to prevent also, and especially doing the bilateral mastectomy, to prevent also that the patient is going to face another cancer maybe in the future if we just treat only that cancer, if she has the genetic mutation, you know.
Absolutely. So you mentioned radiotherapy. So apart from surgery, that of course is the first approach, etc., and we all know chemotherapy, radiotherapy, which are the most common. What are the new therapies that we have in our hands now to fight the cancer in a safe and with higher result rate?
Yeah, so also the medical treatment are changing, of course, like the surgery. And nowadays they are more targeted and less toxic than before. And we have hormonal therapies, we have antibody, which kills only the cancerous cells because they go and destroy the receptor that these cells have on their surface, also like the trastuzumab or HER2 inhibitors. Or we have the immunotherapy, which is very important, especially for the most aggressive subtypes of cancer. So it's important, you know, to tailor the medical therapy to the biology of the cancer, and to, you know, in order to increase the survival rate and also to decrease the unnecessary and undesirable side effects.
Yeah. So just to make clear, you treat the surgical part, the first diagnosis, then you send to an oncologist to do the rest. You don't do this therapy yourself, right?
They are the clever.
Exactly. We are the ones that you know, are doing the hard work, the handwork, and they are the brain behind that. Now I come to my question that, of course, touched my practice as well, because I do a lot of reconstruction. I grew up in a reconstruction center for breast cancer.
And you are amazing.
Thank you. And a lot of patients are asking this about, is the nipple always to be sacrificed during a mastectomy? Can we preserve the nipple? So we know the skin and nipple-sparing mastectomy nowadays. How often do you perform that and try to save the nipple?
Yeah, in most of the cases we can save the nipple. Yeah, so we usually assess just a little bit of subcutaneous tissue just below the nipple during the surgery, and while the patient is sleeping, we assess. We send. It's called frozen section. We check that everything is fine. So if that subcutaneous tissue is fine, it means that also the nipple and the areola complex are fine. They are not involved by the disease, so we can save them. And of course, performing a nipple-sparing mastectomy, the outcome is much more natural and beautiful for the patient who wakes up having her breast, not having the breast tissue, but having her breast.
Exactly. No, that's important, because I notice a lot of changes in the trends in the UAE, especially. When I came here 12 years ago, I remember that I was seeing patients doing the Halsted technique, which is a very initial mastectomy. They remove the muscle. The scar was from here to here, very horrible, very mutilating for the patient.
Absolutely.
And also, I've seen that the breast surgeon at the time, they were not offering any kind of reconstruction, which in my opinion, again, having worked in a breast reconstruction center was the first thing. I remember our general surgeons were seeing the patient, okay, give the bad news. This is the bad news. Now the good news, go to the plastic surgeon, because we are already planning your life after that. First of all, in my opinion, is giving a woman which already received this bad news about having cancer that there is a future, there is a possibility of continue their life. It's not meaning that you get diagnosed with breast cancer, you are dead.
Yeah.
No.
No.
There is something. And offering the possibility of reconstruction is something so important. And of course, now has changed a lot, especially with the income of many European surgeons, where the incidence, I think, is higher than here, so they have more experience in that. There is a lot of sensibilization about the reconstructive part.
We always offer a reconstruction to any patient, unless she's too old or just because she doesn't want. Or another possibility is that the cancer is a particular type of cancer which involves the skin, so we cannot offer an immediate reconstruction, or maybe a delayed one. Absolutely is feasible. So the reconstruction is now an integral part of the breast cancer care.
And again, unfortunately, we don't work together in the surgical theater, because in Dubai you work in several hospitals and you have the licensing. And our licenses don't combine in the same hospital. So you have, of course, a great plastic surgeon you work with. They do a fantastic work on reconstruction. Sometimes I see cases that have been delayed reconstruction, they've been not offered reconstruction, not from your side, of course, from other surgeons. So then they find me, they come to me, and then I offer the reconstruction, which is a delayed one. But again, as you said, the immediate reconstruction nowadays is a common practice.
Yeah.
You go in with your breast, you go out with a breast.
It's a must.
Exactly. Because psychologically, there was a study many, many years ago saying that the most feminine part is their breast. It's not the body contour, it's not the hair, it's not the buttocks, is the breast. So the moment you remove this, you take part of the femininity of a woman outside.
And ladies fear this losing of femininity after a mastectomy. So we need to be there for them. We need to explain the possible options, support their decisions. So our role is very important and amazing.
And this question came now to my mind now. How often do you recommend psychological support for the patients?
Yeah, I always recommend psychological support, because healing is not only treating the cancer physically, removing surgically the cancer, but because receiving a breast cancer diagnosis affects everything of your life, your mental status, your family, your friends, your job, because sometimes you cannot go to work. So having a psychological support is extremely important during this phase of your life.
And it's important also to debunk some myth about life after breast cancer.
Exactly, because there's a myth that you cannot go back to the normal life. This is absolutely not true. There are patients who think, oh my God, I cannot do any physical activity anymore after a mastectomy. But actually, the patient that after 2 months from a bilateral mastectomy, she ran a marathon. You imagine. So you can absolutely go back to your normal life, enjoy the intimacy with your partner, or just you don't have to live in fear of a recurrence for your lifetime, because also the recurrence rate is very low. So what I like saying my patient, it's, okay, I look at her straight in the eyes and I say, listen, this is of course a nightmare, okay, for you in this moment, but it's only a chapter of your life. It's not the whole book. So you're going to go back to your vibrant life in a blink of an eye, just turning the page. Of course, the next few months will be absolutely not the one that you wish for yourself, but then everything has an end. So, and it's not the end of your life, it's an end of this nightmare,
Exactly. I had a beautiful example when I was in Verona in this breast reconstruction center. We had a patient who came for the 2 years post mastectomy follow-up to check the breast, etc. And she came pregnant.
Yes.
And there was, you see this reconstructed breast, which was very nice and reconstructed. You barely see that it was reconstructed, and this big belly. And is such a powerful message, because life goes on. And nobody wants to face this, but life really goes on. And it's so...
Maybe you find the courage. Since you understand that every moment is special every moment is important. So after this kind of diagnosis, so maybe you have the courage to buy a house, or to travel more, or to quit a poisonous relationship.
Sometimes this, tough period in our life, and we all had our tough period for several reasons, change your approach to life. And again, you travel more, you said, I want to do something. So not everything bad that happens in your life is something that needs to put you down.
Absolutely.
For a moment, we are human beings, of course. When you receive this news, that, oh my God, what am I going to do? But then there is something that you can do after that.
You become stronger.
Absolutely.
And I see also that many ladies become also more keen to help other people than before. Before, maybe you think only about your family, your work, your dog. But then after experiences this kind of situation, you want to help people who are maybe they are facing now the same situation you had before,
Yeah.
So it's helping each other.
Absolutely. And you were talking about recurrence. Is there any particular suggestion you can give to women who had breast cancer to reduce the risk, if there is any chance to reduce the risk of a recurrence or not?
Yeah, so first of all, having an healthy diet, lots of vitamins like fruit and vegetable. I'm not talking about taking supplements. I'm just talking having a good healthy diet. And then, of course, avoiding smoking. Smoking is poison for your body. I really hate it. And also alcohol, limiting the quantity of alcohol intake. So this can accelerate the healing process. And regarding a possibility of a recurrence, is seen that having a regular aerobic exercise or try to maintain the level of the stress low, if possible, also with techniques like meditation, yoga, or having a good sleep during the night, so having 8 hours of continuous sleep can lower the inflammation of the body, so can strengthen your immune system, and so can also help to reduce the possibility of recurrence.
Regarding, you've been in this war for many, many, many years. Do you have any particular, and I'm very sensitive about this topic because my mother had breast cancer. Okay, thanks God she had.
My mom too.
Exactly.
So that's why it's very common.
But they're both here. They are super healthy now. So they went through the therapies, but there was the early diagnosis.
Yeah.
For both of them, I think also your mom was early diagnosis.
No, my mom was not an early diagnosis.
No.
So paradoxically, her daughter is a breast cancer surgeon, and she didn't tell me that she felt a lump, imagine.
Oh my God.
Anyway, we've been lucky enough that after 4 years, she's here with us. So.
Exactly. My mom, 10 years ago, she was doing screening every year. And thanks God, they found a very small nodule, just a lumpectomy. She has a small scar on the breast, radiotherapy, and it's fine
amazing.
now. So, do you have any particular, story of any patient that you want to tell us that touch your soul?
So actually, Matteo, every patient I treat, I have the honor to treat. They leave a mark on me. So I always remember the first conversation when they come at the diagnosis, the fear, the tears, the endless WhatsApp messages we always send also the night before the surgery, trying to reassure her. And of course the surgery, I remember the recovery. And what I remember most, it is most important, is the big smile on their face when they come for the follow-up. So when everything is done. So there's a transformation. So from a human being in fear to a wonderful lady smiling. Yeah. And being in Dubai, that we have patients from all over the world with different cultural backgrounds. So it's amazing because you can build this relationship which they can last forever, I think. And I keep messaging my patients all over the world, because maybe sometimes they are here for just a while and then they go back to their home countries. And I have patients who send me pictures of their holidays, or last month a patient from UK sent me the picture of a tattoo she made on her breast with the pink ribbon on the reconstructed breast. And
that we have here just
exactly.
in honor of the Breast Cancer Awareness Month, so October.
A patient from India, there's a lovely patient from India. She sent me the pictures of the wedding, the colorful wedding of her son in Mumbai. Last year I went on holiday to Tokyo and to Nara, and since I had the surgery on a young lady from a Japanese lady like 2 years before, and this lady asked me, my mom wants to know you because you saved my life, so can you please meet her outside that particular temple in Nara? It was amazing to meet this old mom, and she kept thanking me, so and it's so nice.
It's very important also, your profession, again, you touch the life of people in a very specific moment.
Yeah.
And I remember I have the same feeling with when I was working in the burn unit, because you stay in contact with the patient for so long and you become part of their life.
Exactly.
And I have still patients that wishing me Merry Christmas after 20 years.
Exactly.
I don't see them. And it's so beautiful because, first of all, you know that you've done a good job, not only medically, of course, we all try to put our best in the medical, but also, emotionally and personally. And the personal touch, I think, is something very important.
Yeah, last week I received a picture from a patient of mine. She's from Egypt, and she was 27 at the diagnosis. She was single and she didn't get any baby at that time. And then now, after 4 or 5 years, she sent me pictures of a newborn, and she wrote, "Hi, Dr. Anna," and I become emotional. Sorry. "Hi, Dr. Anna. This is Amal," which means in Arabic hope. This is Amal, my baby girl, and she's here thanks to you. That's all.
That's amazing. When you receive these messages, really...
It's priceless.
So I think it, went through a lot of, discussion about the breast cancer. So what's the message is important? I think we have 2 messages. The first one is October, go and get your breast check, do your ultrasound, do the mammography over 40, go and see a breast specialist to check everything. And don't lose hope. If
Absolutely.
There is a bad diagnosis that happens to you in your life, we can fix it. And the rate of mortality and bad outcomes is going down, thanks to your attitude, because the patient needs to go and get checked. And our services, your services more than mine, of course, but and the progress of medicine and all the pharmacies and the medication that we have,
So I'm really hopeful for the future.
Yeah, I'm sure that there was a lot of campaign around this month. I think the most important month in medicine, and because there is also the November, which is for the prostate cancer for men, etc. But October is really became
really
something.
But you don't have to then forget your breast the rest of the year.
No.
You just have to put your health as a priority for yourself, so at the top of the list, and not at the bottom, because I don't have time. I don't.
Anna, thank you so much. It's been a real pleasure to have you as a guest. And you were very nervous about this podcast. She was texting me before, saying, "Oh my God, what shall I say? How can I react?" But you did a great job, and
thank you.
The way you speak, I think, will touch a lot of people. And
I hope so. Yeah.
So you should know that, again, we refer a lot of patients to each other, because when I have, of course, a patient who had a family history of breast cancer, I send to her to get a screening and to be sure that I can go ahead with the anesthetic procedure without any risk and complication. I think synergy between doctors is very important.
Absolutely.
There is
teamwork is dream work.
Teamwork, dream works, and also a very good friendship that lasts for many, many years. That is very important.
Yeah, thank you.
So thank you so much, Anna, for being here. For all my listeners, thank you so much. It's been a very nice episode this time. If you like it, please put a like and subscribe to my channel so you can see more and more topics coming in. I have different colleagues on the pipeline, so I hope you will follow me more. Thank you so much and see you next episode. Because you deserve the best.